Excuse me, madam.
Yes, sir. How can I help you?
May I see the doctor?
Yes, sir. Why do you want to see the doctor?
I am not feeling well.
What symptoms do you have?
I am having difficulty breathing and I feel very tired.
Okay. Can you tell me your name?
My name is Johnson.
What is your age?
I am 35 years old.
And your address, sir?
101 Main Street, Dharavi.
Please pay $20.
Okay, here you are.
Thank you. Here is your receipt.
What should I do next?
Please go to counter number 6.
Where is counter number 6?
Go straight and turn left.
Thank you. Excuse me, is this counter number 6?
Yes, it is. Please take a token.
Thank you. Here is my token.
You're welcome. I am also waiting for my number.
Oh, I see. How long have you been waiting?
For about 15 minutes.
Okay, I hope the doctor comes soon. Yes, me too.
Are you feeling okay?
Not really. I have trouble breathing and feel very tired.
I'm sorry to hear that. I hope you see the doctor soon.
Thank you. What is your token number?
My token number is 12.
Mine is 13. I am next after you.
That's good. The doctor is seeing patients quickly today.
That's a relief.
Yes, please take a seat and wait for your number.
Thank you very much.
Token number 13, please come in.
Yes, that's me.
Good afternoon. Please have a seat.
Good afternoon, doctor.
What seems to be the problem?
I am having difficulty breathing and I feel very tired.
Since when are you feeling this way?
For the last 3 days.
Do you have a fever or chest pain?
No, I don't have a fever, but I feel tightness in my chest.
Do you smoke or drink alcohol?
No, doctor.
Do you have any medical history like asthma or high blood pressure?
No, I don't have any medical problems.
Okay, I will check your blood pressure and oxygen level.
All right, doctor.
Your oxygen level is slightly low. Don't worry.
Is it serious, doctor?
Not at the moment, but we need to do some tests.
What tests do I need?
A chest x-ray and the blood test.
Okay, doctor.
I will also give you some medicine to help your breathing.
Thank you, doctor.
Please take rest and avoid heavy work.
I will. Thank you very much.
You're welcome. Please visit the lab and come back with the reports.
Excuse me, this is the laboratory, right?
Yes, sir. How can I help you?
The doctor asked me to do some tests.
Okay, may I see your test slip, please?
Yes, here it is.
You need a blood test and a chest x-ray.
All right, what should I do first?
First, we will take your blood sample.
Okay, does it hurt?
Just a little pinch, don't worry.
All right.
Please sit here and relax.
Okay.
Done. Now please go to the x-ray room.
Where is the x-ray room? Go straight and turn right.
Thank you.
You're welcome. When will I get the reports? You will get the reports in about 1 hour.
Okay, I will come back then.
Yes, please do.
Thank you very much.
Token number 13, please come in.
Yes, that's me.
Welcome back, Mr. Johnson. Please sit down.
Thank you, doctor.
I have received your test reports.
Is everything okay, doctor?
Your blood test is mostly normal.
That's good to hear.
The chest x-ray shows a mild chest infection.
Is it serious?
No, it is not serious. It can be treated with medicine.
That's a relief.
This infection is causing your breathing problem and tiredness.
I see.
I will give you antibiotics and an inhaler.
How should I take the medicine?
Take the tablets twice a day after food.
And the inhaler?
Use it 2 times a day, morning and night.
Okay, doctor.
Drink plenty of water and take proper rest.
How long will it take to recover?
You should feel better in 5 to 7 days.
Thank you, doctor.
Please come back for a follow-up after 1 week.
I will. Thank you very much.
You're welcome. Take care.
Excuse me, this is the pharmacy, right? Yes, sir. How can I help you? I need to buy these medicines. May I see your prescription, please? Yes, here it is. You have antibiotics and an inhaler. Yes, how should I take them? Take 1 tablet twice a day after food. For how many days? For 7 days. Please complete the course. Okay, and the inhaler? Use the inhaler 2 times a day, morning and night. Should I use it before or after food? You can use it anytime. Are there any side effects? You may feel slight dryness in your mouth. All right. Drink plenty of water and take rest. How much is the total cost? The total cost is $15. Here you are. Thank you. Here are your medicines. Thank you very much. You're welcome. Get well soon.
Hello, Mr. Johnson. Nice to see you again.
Hello, doctor.
How are you feeling now?
I am feeling much better. My breathing has improved.
That's good to hear. Are you taking your medicines regularly?
Yes, doctor. I completed the antibiotic course.
Excellent. Did you use the inhaler as advised?
Yes, twice a day.
Any side effects or problems?
No, doctor. I feel fine.
Let me check your oxygen level and chest.
Okay.
Everything looks normal now.
That's a relief.
You have recovered well. You can stop the antibiotics now.
Do I need to continue the inhaler?
Use it only if you feel breathing discomfort.
All right.
Try to exercise lightly and avoid smoking and dust.
I will, doctor.
If you feel unwell again, please visit immediately.
Thank you very much for your help.
You're welcome. Take care and stay healthy.
Thank you, doctor.